Patella dislocations are another common problem that especially young athletes, 15, 16-year-old kids experience with sports. It's a twisting type injury where the kneecap will pop over to the side off the front of the femur. And when that happens, you tear all the ligaments on the inside of the knee, mainly the medial patellofemoral ligament, but more importantly, you can damage the cartilage on the kneecap. It's a miserable experience if you ever talk to somebody who has it. You know, they dread having it happen again. You have occasionally can knock some of the cartilage off, and that's really why we care about these injuries. It's, you know, a few weeks out from their sport, but more importantly, the damage to the cartilage that can occur long term. We have two options for treating these. One is surgery, to jump to surgery, and that does give us a lower rate of recurrent dislocation, but certainly trying to rehab it and strengthen the muscles is an acceptable way. There's usually some underlying anatomical abnormalities, the way that your knee was built, that can give you some trouble. And one of the surgical techniques to fix this is to cut the bone in the front of the knee and move that to the side and try to change the angle that your quadriceps tendon and your patella tendon pull the patella. And that's called a tibial tubercle osteotomy. The other way to treat this, if there's not some abnormalities in the anatomy and the way that tendon pulls, is to reconstruct the ligament that's torn, the medial patellofemoral ligament. And those are both outpatient procedures. The rehab is very similar to both of them. Limited weight bearing at first, work on the motion, get either the osteotomy or the graft to heal, and then functional progression and therapy back to sports around 4 to 5 months.